I love working with kids because they're honest. They will tell you the truth. If you have bad coffee breath, whatever they want to tell you, they will. So you can trust them. You can trust children. And I also love the differences in the visits. You can walk in a room with a 4-month-old and they'll be smiling away. Or you walk into a room with a 14-year-old and they're not smiling, but it's very fun and different every day. You should know if you're comfortable working with families and adults. You think you're signing up for children, but there are always parents in the room. So you have to work with the parents and the adults. You need to be comfortable. You need to ask yourself, can I work with small bodies? They don't talk to you all the time. It's a little bit like veterinary medicine. You have to figure out what's going on. You have to ask yourself if you like to teach. Most children are healthy, and most of the job is educating parents on how to keep their children safe and prevent chronic conditions. Our students start with we call them the 3 Ps, pathophysiology, physical assessment, and pharmacology. Then we immerse you in the knowledge, the didactic of well baby, well child care, growth and development. Once you're solid with that, we release you into the clinical setting, but you are closely supervised and you get hands-on, 560 hours caring for children. And then we wrap up with a subspecialty experience to give you a flavor of what that role may be. When you first leave our program, you know normal growth and development. You know well kids. You know to recognize something that's a little off and if it's minor, but when you first leave, you ask the more seasoned professional, should I refer this or not? As you gain experience, you get comfort of, yes, I absolutely have to refer this. This abdomen is too hard. It needs somebody else to look at it. This is not a normal baby abdomen. Things like that, you get more seasoned. When you first start the program, you are with most of the advanced practice nurses. So all students are together in a cohort to learn physical assessment, pharmacology, and pathophysiology. And then you narrow down to your specialties. For a while, our students in pediatrics are with family practice students because they need to know children also. And then by the time you graduate, you're just with the P&P students with the chronic illness. So you become more and more specialized as you spend time. So you start with a large cohort and then you get to a more intimate group. Our program and our school is committed to having clinically active faculty teaching the courses. So we are in the clinics 1 day a week, 2 days a week, taking care of children. Our program, when you leave our program, you know normal baby, normal child. You know what that is, and you know minor acute. About half of our students end up in primary care, so they work in offices taking care of well baby, well child, school physicals, sports physicals, and minor acute, just taking care of sore throats and earaches. The other half end up in subspecialty care. I myself am a certified diabetes educator. I care for children with type 1 diabetes. It may be GI, it may be neuroepilepsy. There's just a lot of unique specialty areas that about half of our students end up working in. Well, we have 100% pass rate on our national certification exams. We know the material you need to know, and we make sure you're successful. Our job is done well if you are successful. You have U of M name recognition. Our resumes of our students go to the top of the pile. You just pop to the top. And we bring that real life expertise to the lectures and the case studies. Another unique part of our program is we do have Mott Children's Hospital just down the road. The faculty teaching you is hands-on in the trenches with these families. We bring you real experience, real life education, and also that we find the clinical sites for you. I cannot stress how difficult that is and how hard it is to knock on the doors by yourself. We open the doors for you.